Hi, my name is Aaliyah Flores, and welcome to another episode of In Good Health with McLaren Macomb. Today we will be talking with Dr. Kurtis Kieleszewski, who will be telling us if we are getting enough sleep or not. And then we will be heading to Stony Creek and back to the beach. But first, we're here with Dr. Pulin Patel at the start of allergy season. Welcome, Dr. Patel.
Thank you for having me here today.
Thank you for being here. And could you just share with us a little bit of your background?
Yes, I basically I did internal medicine internship at McLaren Macomb Hospital, and then I went to Detroit Medical Center to complete my internal medicine residency, and then followed that up with a pediatric and adult fellowship in allergy and immunology. And I'm now practicing in McLaren Macomb Hospital as an allergist.
So why do so many of us get allergies this time of the year?
It's a great question. So what I'm thinking is that the weather is the biggest thing that happens at this time of the year, especially in Michigan. We have a lot of warm weather that starts from cold weather and transition into warm weather, spring, summer, into fall. What happens with the warmer weather, we have plants that bud, pollination that happens, the pollen gets released. A lot of patients, unfortunately, have a sensitivity to pollen. So in other parts of the country, people are used and exposed to that for most of the year. Michigan or Midwest, we have a lot of winter months, 6 months where the pollen is dead. At this point, when the pollen starts coming out, we start having those symptoms. So at this time of the year, what the biggest factor is the environmental allergies. And this can be different types of pollen. There's tree pollen, grass pollen, weed pollen, and ragweed pollen. All come out at different times of the year. So it all depends on what each individual patient is sensitized to.
Are there other factors that can contribute to allergies?
Yes. So initially I mentioned that this time of the year, yes, we have a surplus of people with allergies, but it doesn't mean that allergies are only during spring or summer or fall. We have patients with winter or perennial, all year round allergies. So we have patients who suffer all year round, and these ones are mold spores, pet dander, which are cat and dog dander that triggers our symptoms.
Okay, so more indoor
allergies.
Okay.
So those can also contribute to some of the patients having worse outdoor symptoms, because if someone already has perennial symptoms and then they also have seasonal symptoms, that compounds the fact for those patients.
So we can have indoor allergies as well as outdoor allergies around the same time frame, and the symptoms will be the same?
Correct. So what happens is the symptoms are always the same, but certain things can actually make symptoms worse. So patients do have just even perennial allergies, just cats, dogs, mold spores, dust mite, and never have even seasonal issues. And they might have symptoms just for a couple months in certain times of the year, and we might contribute to that to environmental triggers like the pollen. But in reality, when we do testing, they don't have any pollen that shows up. It's just the indoor triggers.
Is there a certain time frame where it might become more severe than others?
Unfortunately for those patients with indoor allergies, it can be any time of the year. And that's the hard part with allergies. The hard part is if you have an animal dander, cat dander, dog dander, and you have pets at home, plus we all have dust mite. No matter what we do, we always have dust mite. There's certain avoidance measures we can do to try and minimize that.
And what would those measures be to minimize dust mites?
For dust mites,
I know that I probably have them in my house along with everyone else, and what can I do to diminish? Yes.
Correct, and this is the first step in any kind of avoidance kind of measures. Is first thing in allergies, always trying to do avoidance measures. So if we could talk about a few different things, I'll talk about just dust mite, but I'll also talk about other things we can try and help minimize.
Perfect.
Dust mite, the first thing and most important thing is washing everything in hot water. All the sheets, towels, bedding in hot water. Dust mite only unfortunately dies with hot water. So warm and cold water when we do laundry with sheets, towels, bedding does not help. The second most important thing is getting allergy-proof cover sheets for the mattress and the pillow. And that is found at all numerous stores, and that's the most important thing, is those two things. There's a lot of other things we can try and do that cost a lot of money, but the two simplest things, two most proven things are doing those two things.
And how often should that washing occur?
The washing should occur at least every week. So if you're doing the sheets, towels, bedding, every week you should be washing them in hot water. And also, obviously, putting the covers on, allergy-proof covers.
Okay. Perfect.
Now, there's other avoidance measures as well. Correct, there's other avoidance measures. So that's just for dust mite. If you take pollen, for instance, and that's the time of the season that we're talking about right now. So a lot of people, as I mentioned initially, it's tree pollen, then grass, weeds, and then ragweed. So if certain patients are allergic to one of the four or all four of the pollen, what you want to do, regardless of what you when you find out what you're allergic to, you need to, at that time for that season, you need to always have the windows closed at home. That's number one. Windows closed at home when you're driving in a beautiful drive up north, you
Right.
want windows closed. You want to have less exposure to that pollen.
Okay.
But I don't want you staying indoors either. I want people to enjoy the weather. I want people to go outside. So they go outside. You have children, you have adults who go outside. You go for a bike ride, walks. When you come back indoors, you change your clothes, you wash up. You wash your face, change your clothes, wash your hair. So that helps reduce the pollen.
Okay, because a lot of the pollen can get
Correct.
stuck
It's
in
stuck.
your hair, and then you go on your pillow and you sleep on
Exactly.
your
You're
pillow, and then you're
correct.
just transferring all the
Yes.
pollens. Okay.
It's in your pillow and your clothes. You're indoors for part of the day. You're sitting on your couch, anywhere else. So you want to try and change those kind of things. Even taking a shower at nighttime during spring, summer, fall season is the best thing because you're trying to wash up and get rid of all the pollen before you go to sleep. So these are small steps you can take for pollen avoidance measures. But I want people to enjoy themselves. I want people to go outside.
Absolutely, it's so beautiful outside. From being a parent of, and I have children that have severe allergies, what advice could you give parents to help with some of the symptoms as a young child or even teenager? Playing sports, let's say, and they're out in
Yes.
on a sports, a field,
Yes.
and there's a lawnmower, going by and cutting grass.
Well, the problem becomes how severe the symptoms are. I have patients who have very minimal symptoms. They could just have sneezing, runny nose, minimal symptoms. I would, at that point, is doing with the avoidance measures we had talked about. As soon as they finish playing their sport, washing up, cleaning up, doing that. However, there's a lot of patients, unfortunately, symptoms step up further. They can't breathe through their nose. They're so stuffy. Eyes start swelling up, or they even have respiratory symptoms, asthma symptoms start triggering up. If there's certain things that are getting worse and worse, unfortunately, at this point, we have to step in and try and do medications. There's a couple of different over-the-counter choices and prescription choices. But at this point is when we would add nasal corticosteroids, which are the mainstay of any allergic rhinitis. So nasal corticosteroids on a daily basis. These are prevention medications.
So the child or parent, they would have to take the medication on a
Correct.
daily basis.
On a daily basis. And the best thing would be to start it at least a couple of weeks ahead of time, ahead of the season. So if you have just tree pollen, which comes first, as I mentioned, that comes in early spring. So I'd want medications to be started by March, a couple of weeks before the season starts, so that way you at least have the medication in your system while you enjoy the sport or go outside and do the activities. Then it all depends on that. If that is able to sufficiently control your symptoms, that's all you need. The less, the better.
Right.
There are other steps out there. We can add oral antihistamines and other nasal antihistamines as well on top of these medications. And another class of medications is called leukotriene modifiers, which is a medication such as Singular, which helps with both breathing issues and allergy issues as well. But there's different levels, all depending on the symptoms the patient comes in with.
Okay. What is the difference? I hear this word used a lot, hay fever. What is the difference between hay fever and allergies?
That's the funny thing. So a lot of times when patients come in, do you have allergies? I'm using the word allergies. Do you have allergy symptoms? Runny nose, sneezing, stuffiness, congestion, itchy eyes, watery eyes. A lot of patients say no. They might have been sent for asthma issues or other issues, but I'm still getting a full history. Later on, I use the word hay fever. Do you have hay fever? Does your family? I'm getting a family history. Oh yeah, they go, oh yeah, I have hay fever symptoms. This. So to me, it is exactly the same symptoms. It's the same symptoms. So, but people equate hay fever to something different. In reality, hay fever is allergies. Allergies are hay fever. So to a medical professional, it's the same thing. It's the understanding by the patient or the population. They might think it's something different. It is not different. It is the same thing. So as a physician, I have to understand that, and I have to try and bring about questions by asking it various different ways. If I want answers for something, it's hard to always get the answer the first way or the right way because patients in front of me don't understand what I'm always talking about.
Right.
So you always have to try and figure out different ways of bringing about it. And that's one of those things is actually saying that word, hay fever. It's a trigger, but it is exactly the same word. It's allergies. Now, some people will say hay fever just because they only have spring or fall or summer symptoms.
That's what I always thought hay fever was just in the fall.
And or spring or summer, people might say that. But regardless, it's the word, it's still part of allergies. You still have allergies. You can have seasonal allergic rhinitis or you can have perennial, which we had talked about, but they're all the same condition. Now we just have to differentiate what you have, what's triggering it, and how to try and fix that problem.
Wow, you have given us some great advice on allergies, the difference between environmental allergies, indoor, outdoor allergies, and we really appreciate you sitting down with us today. Thank you so much for coming to the show. Is there anything, one more tidbit of information you could give our viewers today?
Well, what I would tell patients is I still want patients to enjoy life, regardless of what your allergies are. I still want you to enjoy. But as I mentioned before, there's a lot of different avoidance measures. You can have avoidance measures for dust mite. We didn't go over all the different ones. There's pollen avoidance measures, pat dander, mold. We want to go over all that kind of stuff. So I still want patients to enjoy themselves, but there's different avoidance measures people can start taking, implementing, that can help reduce how their symptoms will be affected by the environment they live in.
Okay.
So if we are able to do that and minimize that, they can still enjoy a full life and healthy life and be happy, basically.
Okay.
So regardless
and
of what
are your patients
allergies,
pretty compliant too? Do they listen to you?
yes, I think the patients who actually have suffered and are actually finally seeking this an allergist profession, because a lot of times patients go over the counter. There's a lot of over the counter medications. Then they have primary care. Then they have primary care physicians they can go to, obviously. So if they're seeking health from an allergist, I think at that point they're actually willing to take the extra steps and go into trying to listen to what we want to try and do, because it's not always medication,
Right.
or allergy shots. It's part of avoidance measures as well, and that actually helps simplify things. But I still want people to enjoy themselves.
I do too, most definitely, especially with all the beautiful weather that
Yes.
in the winter and summer too.
Yes.
And we thank you so much today for coming in and sharing all of your experiences and advice with us. Take care
Thank you.
and have a very good day.
Thank you so much.
Okay.
For more on allergy prevention, visit mclaren.org/Macomb Allergy.
And now back to the beach.
Hi, well today is the 6th annual Back to the Beach race. We're here at Stony Creek Eastwood Beach, and we're having a great time. Other than the fact that it snowed in the morning when we got here at 5 o'clock, the sun's finally coming out. I think the runners are having a great day at the race.
It was great. We had a great turnout with McLaren Macomb. We had about 14 runners. It's a little chilly out. I think I saw a little bit of snow, but nothing's going to stop us really.
All things considered, you know, it's a successful event again. We're sponsored this year, as you know, by our friends at McLaren and McLaren Macomb, Oakland, and the healthcare group. We really appreciate that support. It's a big part of being able to do all the things we do with the various charities that we help and support throughout the year.
Oh yeah, I mean with McLaren Macomb really emphasizing health. We got some runners out here. We got a lot of support for the community with McLaren Macomb. And we got two great teams. We got McLaren Oakland and McLaren Macomb having a friendly competition.
Last year I think Macomb won, and I'm not quite sure. I haven't seen any results, but it looked like it was a pretty good race again with the groups.
Well, the results quite aren't in yet, but I think it's obvious McLaren Macomb's going to win.
Well, Medals for Metal is a charity where we encourage runners who have done half marathon, triathlon, and ultra medals to donate those finisher medals to us. We reband the ribbons and we put on a charity ribbon, and then we bring those medals into children's hospitals around southeastern Michigan. And it's kind of fun. In the 6 years that I've been doing it in Detroit, we've now given out over 5,000 medals to mainly kids, but also adults. There's another Joe friend of mine. He's faster, so we started describing ourselves as Fast Joe and Slow Joe because our bibs would get mixed up on occasion, and so that kind of stuck. The reason why we started the race was for supporting Medals for Metal in Detroit. It's a charity that I started a division of. It was an idea to have a little race. We might get a couple hundred people to come out and raise a few dollars, and next thing you know, here we are. We've got 1,600 people coming out running today. We have 350 volunteers. We run through 2 counties, 4 cities, and it's turned out to be a great event.
To learn more, visit mclaren.org/AMI.
And now we're here with Dr. Kieleszewski. Thank you for coming to the show and joining us today.
Thank you for having me.
No problem. Just could you share with us a little bit about your background and your experiences?
Sure. I am born and raised in southeastern Michigan. I attended Michigan State University's College of Osteopathic Medicine for medical school, and I'm proud to say I truly am an osteopath. I attended McLaren Macomb for both internship and residency, nice. And currently am in a private practice practicing family medicine in Clinton Township.
Okay, nice, perfect. Well, the question of the day, and I'd like to know myself for personal reasons because I don't get a lot of sleep, but are Americans getting enough sleep?
The answer for nearly half of Americans is no. And matter of fact, about 30% of us are legitimately sleep deprived, getting less than 6 hours per sleep on average each night. And that absolutely correlates to problems. That number translates to about 96 million Americans. So the vast majority of us need to get more sleep in our daily routine.
So what does that amount of sleep look like, that number of hours of sleep look like?
It certainly depends on your age and different circumstances. But what I share with my patients and parents, for example, when I'm talking about their children, is a general rule that for each age group, it's about a 2-hour difference in terms of sleep throughout the day. For infants, they require 14 to 16 hours. That does include their naps. Toddlers, more so 12 to 14 hours per day. For school-aged children, 10 to 12 is ideal. Once we get into the teenage years, despite what many parents and teenagers will tell you, they still need 9 or 10 hours per night.
Okay.
And lastly, for adults, which is certainly the majority of the issues I discuss, they still require 7 to 8 hours per night. And many adults are still surprised and will not admit that is in fact in their best interest and benefit.
So why do you think what are some of the issues that adults might be, when you see them come into your office, that they might be experiencing that because they're getting possibly lack of sleep?
Many issues exist.
Okay.
By far the most important aspect in terms of my interaction with my patients, we have to start with sleep hygiene. What things are going on leading up to their retiring for the evening? What are they doing to put themselves in a calm, relaxing state? What is the bedroom like? For example, it should be dark, it should be quiet, there should not be lights, should not be sounds like a television or a radio. Are there any objects, pets in the bed that are distracting us?
Pets in the bed.
No,
I'm guilty.
absolutely not. So many people do admit to having their friendly fur ball with them. That's not a good practice. Children also. Children should not be sleeping in bed with mom and dad.
There too. Okay. So are there any medical conditions that might hinder patients from being able to sleep and get that good night rest?
Absolutely. Plenty of people suffer from issues such as insomnia or just general anxiety that prevent them from falling asleep within a reasonable amount of time. Others wake up during the night for different reasons, whether that's they're restless, perhaps restless leg syndrome. Some people, unfortunately, have issues where they have to wake up frequently to urinate. And there's also plenty of other people that have other sleep-specific disorders, such as obstructive sleep apnea.
And how do you acknowledge the fact that these patients come into your office and want to do a sleep test?
Sometimes patients will be very forthcoming, and they've been told by a family member or their spouse that they snore and they stop breathing. That's a pretty easy segue and assessment into those issues. Other times it has to be a little bit more investigative and more questions coming from me to really pull the truth out of what it is that's affecting their quality of sleep or quantity of sleep.
So what would cause a patient to have lack of sleep? What are some of the outside influences that would affect the sleep of that person? I know we talked about work and stress and anxiety.
The actual quality of sleep that we get is sometimes just as, if not more important than the quantity itself. Going back to feeling stressed or anxious, some people, my wife included, often finds herself lying in bed and her brain starts to spin with what she has to do the next day, what errands are on the agenda, and she finds it helpful just to write that list of things to do before she even goes into the bedroom at night. So she feels a little bit more at ease. She wakes up and she starts attacking the day, per se.
That's really good advice. I'm going to have to take that as well. And are there any breathing exercises or anything that one could do for to be able to stop being so anxious or worrying before they go to sleep?
I absolutely encourage people to do various relaxation activities, whether that's simple breathing, praying, doing yoga, just basic stretches. You don't want to be overly exerting yourself or exercising, running miles and miles around the neighborhood or on the treadmill right before you go to bed, but it is helpful to be in a calm, relaxed state and just be ready for your head to hit the pillow and get a good night's rest.
So how can this lack of sleep negatively impact our overall health and well-being?
In many ways. As a matter of fact, a recent poll found that 45% of Americans admitted to having their sleep or lack thereof negatively impact at least one day in their life over the past week. And some of the ways that can affect us is to be a precipitating factor and lend to chronic diseases such as hypertension or high blood pressure, diabetes, depression, low testosterone, particularly in males, and not to mention what we all can attest to is our general crankiness from time to time and irritability. And in one other aspect where we see sleep deprivation negatively affect us, motor vehicle accidents, mishaps in an industrial environment, or just general lack of productivity in the workplace.
Okay, so no television, no looking probably at a telephone or an iPad. Make sure that the room is quiet and no fur babies or dogs in the bed, cats with you as well.
Absolutely.
And for the average adult, how many hours of sleep did you say?
7 to 8 hours
7
per
to 8.
night is
Okay.
what's recommended, and that obviously can be increased based on acute illness or injury, because we should certainly be giving our body slightly more sleep in those periods to allow ourselves to heal.
Okay. So what can we do moving forward once we as patients have said, okay, I need to go and see my doctor because I'm having lack of sleep. I'm tired all the time. I'm irritable. I can't function at work like I should. We make an appointment to come and see you. At that point, what test might you do so that we can say, okay, this is the reason and here's the reason why I'm not sleeping good at night?
Step one is always addressing the sleep hygiene issues.
Okay.
How are we preparing to go to sleep? The setting of the bedroom, like we discussed. And until we have taken those issues seriously and the patient will attempt to make the changes, I would never even consider putting anybody on any kind of prescription medication. That also does lead sometimes to prescriptions. Also, like we mentioned with sleep apnea, that does require a specific sleep test. It's called a polysomnogram that is performed in a specific sleep lab supervised by trained technicians. It's discussed and reviewed by a trained sleep medicine physician. And the results of that are not always just clear-cut with sleep apnea. There's many other diagnoses that can potentially be discovered during a actual sleep study.
Like what other type of diagnosis?
Restless leg syndrome, various forms of narcolepsy. Different people also sometimes struggle to actually go through all the different stages of sleep. To be technical, there are 5 stages of sleep, and we cycle through those stages every single night, 1 through 5, over and over and over. Some people struggle to actually get into those later stages, which are the deeper sleep, where we become harder to arouse, but where we also are getting more significant rest, where we're improving our immune system, where we are solidifying what we've learned over the day and the previous weeks. And that's one of the big misconceptions that people have is sleep is not just for rest. Sleep is for our minds as well, just as much. We solidify what we've learned, skills, information, and we hone it into more of a long-term memory.
So those 5 stages are very important to go through. Do you find that
Yes.
most of your patients are going through those 5 stages?
Most people, yes.
Okay.
But again, different medical problems can also cause them to be waking up throughout the night. And certainly the frequent urination during the evening is something that we often address. And sadly, that's probably one of the more common things that people will experience and suffer, but just internalize, not speak with their physician about it, not bring it to our attention. And that's unfortunate because there are many options for people to significantly improve their quality of sleep by fixing that problem.
So it seems like a lot of those symptoms can be fixed and then be able to help the patient sleep at night.
Absolutely.
Soundly. That sounds good. Well, that's perfect. Well, if you could give us one tidbit to help your patients sleep better at night, what would that one piece of information be?
Just one piece would be difficult.
Or two.
Okay, try to keep with a regular routine throughout the night, and not just weekdays. Weekends are also just as important. Okay. So approximate the same bedtime, the same arousal time is a perfect start. And to make sure that the bedroom, like we said, is dark, is quiet, we don't have things that could potentially be waking us up. And those two issues are a perfect start to getting better sleep.
Well, perfect. Well, thank you so much. Thank you for coming in and sharing all of those great information with us today, and we really appreciate you being here.
Thank you very much for having me.
Thank you. Take care.
You too.
To learn more on sleep and your health, visit mclaren.org/Macomb Healthy Sleep.
Thanks for watching. We'll see you next time.
To view this episode again, visit mclaren.org/MacombBlog.